Hi, this is going to be a recording of Vocal Info Session number 8, focusing specifically on vocal anatomy. We're looking at the different pieces of the vocal tract and what we're using them for, how they're being used, what they're going to do to our voice, and what they contribute to our voice. First off, though, a little bit of a welcome and intro, a little bit about me to start. I'm not a speech pathologist, and I am not a career professional. So this is the kind of thing that I have been doing as an amateur for quite some time, but it's not the kind of thing that I have a 6-year degree in, and it's not the kind of thing that I am doing every day of my life as my living 8 hours a day. I don't have the experience that those people will have. I do have some of my own experience, but I want to make sure that everybody is aware that I don't have a certificate or a indication that yes, this is exactly the thing that I'm qualified to do. This is something that I am learning by practice. That said, I do have 20 plus years of various other vocal experience, adjusting my voice for singing, acting, voice acting, ASMR, all sorts of other different things that I've used my voice for. So I've got a fair amount of basis in learning how to adjust, adapt, and change my voice. And I also have a fair amount of experience now in vocal feminization, which I had to learn for myself for my own transition, and which I'm now learning how to teach others so that I can help them through their transition. I'm currently learning to teach how to do vocal feminization from a career professional. The person who was helping me with my own vocal feminization when I was transitioning, or during that part of my transition, I'm still transitioning, is a career professional. She does this every day as her day job. She is currently in the process of getting a degree in speech pathology, and she is often referenced as a keynote speaker at various university conferences on the subject. So she knows what she's talking about, and that's where I get all my information from. When it comes to healthy practice, there's a few tips that I recommend you follow. First, always warm up. This one's super important. We want to make sure that we give our voice nice, easy ramp up to whatever it is that we're going to be practicing that day, and that we don't damage our voice in any way. I promise you, permanent vocal damage will not help you get to the target voice that you're after, so we want to make sure that we're always warming up before a session. Next, keep hydrated, and water is your best option for this. We want to make sure that you're always drinking something while we're practicing, just to make sure that we're keeping ourselves nice and hydrated, keeping that vocal tract nice and comfortable. Water is our best option because especially things that are caffeinated, carbonated, or sugary will cause either chemical reactions that make our vocal stamina go down, or will cause some kind of discomfort or irritation. So stick to water for about an hour before your session and then during your session. Any other time during the day, go for it. Drink what you like. If you feel any pain, strain, or tension as you practice, it's time to give it a rest for the day. It's time to make sure that you don't, like we were talking about in the warm-up, you don't strain yourself, that you don't cause any permanent damage to your voice. A little bit of pain, strain, or tension is just a good signal that it's time to stop. You don't have to be worried about permanent damage right away. We just want to make sure that we listen to those body signals and stop when we are sort of informed that we need to by the parts of our body. And lastly, there are lots of exercises out there, some of which have been made obsolete by other exercises, and some of which have been stopped being used for various reasons, including this exercise. We want to make sure that if you see the exercise where somebody instructs you to swallow and then try and catch it halfway through, or stop the swallow halfway through, or hold that position, that we don't do this exercise anymore. In the worst cases, this can cause choking, so that's obviously something that we want to make sure that we avoid, but it can also cause a fairly significant reduction in vocal stamina or some very uncomfortable sensations in the vocal tract. So if you see this exercise anywhere, make sure that you skip it. Just give it a pass. The way that I was taught and the way that I pass along info is less applicable to today's presentation because it's not going over the actual production of the voice so much, but in case you're looking at other lessons after this, my general method is to have somebody go a little bit over the top, have someone get a little bit cartoonish first, and then dial back to whatever it is that they're actually aiming for. This helps with a few things. One, it gives us a larger amount of vocal control, but two, it helps us differentiate the voice that we had and the voice that we're aiming for. That always sounds a little bit silly at first, but it is the kind of thing that you will eventually start to find gets mushed together, gets a little bit gray area. So we want to make sure that we have a nice, strong, defined separation between the two as we're working on the early steps. So, let's talk about vocal anatomy. We've got some key vocal anatomy pieces to go over first. Later on in the presentation, I will be showing these all off again, but I will be showing them with a graph, a medical cross section, so you can see what they look like. It's in black and white. It's not like, gory or brutally detailed. But if a black and white medical cross section is uncomfortable for you, I will make sure to, add a little warning in before we get to that point. So, first, the tongue tip. Most people are familiar with the tip of their tongue. You can see the tip of your tongue in your mouth whenever you stick your tongue out, or even out of your mouth when you stick your tongue out. Lots of folks are very familiar with their tongue tip. The tongue tip is used a lot for diction, for making the various sounds that we use when we speak. It's also used a lot for helping maneuver the rest of the tongue, which we'll talk about in a moment, to help us change our sound and help us adjust our oral resonance. Speaking of, the next piece we'll talk about is our tongue root and the back of our tongue. Now, these are two slightly different pieces. The back of your tongue is the piece at the very, very back of your mouth, the stuff that you can see just before the tongue disappears into the throat. The tongue root is all of the stuff that exists within the throat. There's lots more tongue that exists within the in the throat area that you can't see. This is your tongue root, and the tongue root is something that we'll want to focus on later on for various reasons, but most specifically because we can use it to fill up more of the space of our throat and our mouth to reduce the amount of overall space, and as a result, brighten up our resonance. Next up is our larynx, still talking about resonance. Our larynx is a large tube that exists, or relatively speaking, a large tube that exists within our vocal tract. Vocal tract just being all of the different pieces that we use to produce our voice. The larynx is a large tube in there, and like I was just saying, the bigger the space, the darker the sound, the smaller the space, the brighter the sound, and generally speaking, we're aiming for a brighter sound. So as a result, we're going to try and reduce the amount of space in the larynx. It's one of the primary things that we focus on when it comes to vocal feminization. So the larynx is a very key part of making sure that our voice sounds the way that we want to. Next up is the vocal folds. The vocal folds are very important when it comes to producing our voice because that's where the voice comes from. The vibration of the vocal folds is what produces the sound of the voice. So obviously it's very important that we know where those are, what they're doing, how they work, and how they sort of are positioned in the vocal tract, what they're affected by. The palatopharyngeal arch is next after that. We've got an arch of muscle at the back of our mouth before we get to the back wall, but after we've seen the uvula, that little dangly piece. So in between the back wall of your mouth and your uvula is a arch of muscle. If you need an image of this, I can send you a picture of mine. It's lovely, I promise. And we're going to use that as a means of, again, reducing the amount of space present in our vocal tract to brighten up our overall sound. It can make a fairly significant difference, but it's a little bit tricky to get it adjusted to make it work. So lots of people take some extra time working on their palatopharyngeal arch. Again, I'll be showing all of these pieces off on a diagram in a moment. So what do the throat parts do? First, the vocal folds. The vocal folds are our guitar string. They're our sound source. They're where we're generating sound from. So we're taking air into our lungs to start producing our voice. As we breathe that air outwards, we're going to get it's going to be pushed past the vocal folds, and that push is going to make the vocal folds vibrate against each other. They're going to vibrate open and closed, and it's that vibration, much like playing a string on a guitar or making a reed vibrate on a saxophone, that's going to generate the sound that we're looking for. So it's that vibration that is produced by the vibration of the vocal, that vibration that's produced by the vocal folds that's creating the sound that's coming out of my mouth right now, for example. Then there's the larynx. The larynx is that large tube we were talking about before. I'll point it out in a moment. That is going to be sort of the primary space change when it comes to affecting our resonance. Our resonance is based purely on the size of the vocal tract and how much space we've allowed to be in the vocal tract. As you go through testosterone-affected puberty, this space tends to get quite a bit larger. So what we're aiming for when we're doing vocal feminization is making that space smaller again. This generally comes by raising the larynx, bringing the bottom up closer to the top to make a smaller space for the sound to resonate in. So we're going to focus on a lot of the muscles around our laryngeal area, or our larynx, and we're going to try and bring that larynx upwards again to make the space smaller, and as a result, make the sound brighter. What do the various mouth parts do? Our platopharyngeal arch does similar to what I was talking about before, open and close. Basically not much more than that. It helps us generate some of the sounds that we make. But more importantly, for our sake, it's going to open and close and make the space sort of towards the back of your mouth larger or smaller. If we engage the platopharyngeal arch, it makes the space smaller, and as a result, it makes the sound brighter. The same is true of our tongue root. We're going to use the back of our tongue and the root of our tongue to raise the sort of overall mass further up into our mouth to take up more of the space of our mouth. Smaller space, brighter sound. Smaller space in the mouth, brighter sound overall. It also helps us with pulling the larynx up. The root of the tongue is attached to the top of the larynx, which means that if we pull the tongue root upwards, if we learn how to raise the root of our tongue, we're also going to get an extra little boost to how we raise our larynx. Our tongue tip is mostly going to be helping us out with guiding the back of the tongue and guiding the root of the tongue to those positions that we were talking about in just a moment ago. But it's also going to help us with adding a little bit of texture, a little bit of color, a little bit of shimmer to the way the voice sounds as we're pronouncing various words. Used a lot for diction, used a lot for making yourself very clear, keeping your sort of pronunciation of various words quite clipped. So we use our tongue tip a lot. This one tends to be fairly intuitive for most folks because it's one that you've been using quite a lot for quite some time. There's also other pieces that go on when it comes to, or other pieces that get used when it comes to producing our voice. There's our nose, which is a smaller cavity than most of the other cavities in our vocal tract. That we'll use a lot for n sounds, nasal sounds, n sounds, m sounds in particular. There's also our lungs. We couldn't produce any of this sound without our lungs. We need the air to go into our lungs and then out of our lungs to get those vocal folds moving. If the vocal folds don't move, then we're not in a spot where we're producing any vibrations. And we've got everything else. There's a whole lot of other pieces that exist within your skull, within your throat, within your chest, that are helping you with the way that you produce your voice. I just don't touch on them as much because they're not as specifically focused upon when it comes to vocal feminization. I'm also not necessarily medically qualified to talk about all those different things. I only know the information about the pieces that we specifically use for vocal fem. So you'll need to be looking at more of a sort of biology lens if you want to learn more about what's going on with those different pieces. So I'm going to jump back to our throat parts, and this is the point at which I'm going to give about 5-6 seconds or so, or I'm going to let you know that the medical diagram is going to be on screen shortly. So if you need to pause now, or if you need to call it here, this is a great time to do it. Otherwise, I'm going to put the sagittal cross section, or just the cross section that we're going to be using, on screen in 3, 2, 1. Here it comes. So this is what we're using when it comes to our vocal tract. There's a whole bunch of different pieces. Let me see if I can make this a little bit larger. I can. Lovely. And I'm going to draw on this. So what we're looking for are the throat parts to start with. We're going to start with our vocal folds and our larynx. So that's in here. Our vocal folds are the piece right here. We're going to start breathing down at our lungs down here. We're going to push that air out our trachea into the larynx area and get these vocal folds vibrating. Once the vocal folds are vibrating, they're going to vibrate in this larger space that makes up your larynx. You can see that there's a fairly large space in here. If we want to aim for a brighter sound, which most of the time we do when it comes to vocal feminization, we're going to try and take this space and make it more like this space. We're going to try and bring that bottom piece upwards so that we can reduce the amount of space present in the vocal tract. We want to make sure that we're making it as small as our voice requires, but not so small that we're causing any obstruction or causing a sort of overcompensation for the sound of our voice. There are some instances where we'll find that our larynx gets a little bit too high. It can cause a partial blockage sort of hereabouts. That will make it a little bit rattly or a little bit hard to produce the voice that you're looking for, make it feel almost sort of choked or a little bit muted. So we want to make sure that we're raising our larynx, but not too much. So this is going to be our primary space change. You can see how much space that we've got in here that's roughly associated with the larynx, as opposed to, just this space for our mouth or this space through our throat. Not nearly as big as this big chunk in our larynx here. So we want to make sure that we are focusing lots of time on learning how to shrink the laryngeal space, shrink the larynx space. While we're here, we can actually talk about your thyroid cartilage, also known as the laryngeal protuberance, also known as the Eve's apple or the Adam's apple. You'll often see a little bump on the front of the throat here as a result of having this chunk of cartilage here. It's a little plate of cartilage that is attached to the larynx. Now this is important to us because we're working on trying to get the larynx raised. We're trying to make the larynx move higher. And because the two are attached, you can often use the Eve's apple or Adam's apple as a good example or a good physical reference as to where your larynx currently is positioned. If the Eve's apple moves up, that means that the larynx is also moving up internally. Now, this is not the kind of thing where you can grab your Eve's apple and physically force it upwards. You're going to have to use the muscles around it to move it upwards. But it is a good example, and it is a good way to check to see if our larynx is in the raised position we're looking for. Now let's move on to the throat parts. Or into the mouth parts. Sorry, we were just on the throat parts. Let's talk about the mouth parts. So this section here, this is kind of still in your throat, but we don't really need to talk about that too much. We're going to start in here. So we're going to start with the palatopharyngeal arch, which is sort of right here. It's not something that's particularly easy to show on this diagram in particular because it's sort of on the sides. So by bane of the fact that we've got a cross section, we can't really see it, but it's roughly in this section somewhere, depending on how your mouth is shaped. And it's going to be two folds of muscle, one on each side of the sort of back cavity of your mouth. We're going to look to flex those muscles and bring that arch inwards to reduce the amount of space and make our sound brighter by making the space smaller. Next is going to be our tongue root and our tongue back. So our tongue root is all of this. This whole chunk is tongue root, or thereabouts. Eventually it sort of moves into tongue back up here, but all of this is your tongue. This whole muscle is your tongue. So we've got lots of tongue that we never see because you usually only see to about here in your mouth. So this is about where your tongue back is, give or take. All of this is still tongue. That's all tongue root. So it's important for a couple of things. If we can raise it here, that's going to reduce the amount of space in the mouth. So currently we've got it at this height. If we raise it a little bit more, we could have it at this height and reduce that space in between quite a bit. Also important because it's attached to this, which is the top of your larynx. You can see how the two of them are attached together. We're going to bring our tongue root upwards, and by doing so, we're going to bring the larynx upwards as well. So if we bring this section up, because it's attached down here, it's going to bring that up as well. That's one of the reasons that we try to raise our tongue root as much as we're able. Then we're going to move on to the sort of body of the tongue, or the rest of it, basically. We're going to focus on both the body of the tongue and the tip of the tongue. The body of the tongue is going to go with the tongue root, so specifically focusing on the back of the tongue here. As you lift the tongue root, you also want to be lifting the back of your tongue to round the tongue out and take up more of the space present in the mouth. Again, the smaller the amount of space the air has to resonate in, the brighter the resonance is going to be. So if we reduce the amount of space present in our voice, or present in our mouth rather, by using our tongue, we're going to brighten our voice up at our mouth as well. And then the sound is going to arrive at our tongue tip, where we're going to use the various pieces of our mouth, our teeth, our lips, our gums, our tongue tip, as well as just the space present in the mouth and how we've positioned the tongue to create various words, to create the sounds that we're after. And then there are various other pieces. Our nose is up here in this area. Our lungs are down here in this area. Much further down, but you get the idea. And like we were talking about before in the previous slide, there's lots of other terms. There's also a whole bunch that I've cut off on this side. All these lines eventually point to terms that we don't need to be super worried about. There's a lot of biology going on here. There's a lot of different pieces that do get affected by how we change our voice, but aren't necessarily required for doing our vocal feminization practice. So generally speaking, I just move past them and don't highlight them. So, for a final recap of how everything works. We start by breathing in. The air comes through our vocal tract down into our lungs. Great. We've got our lungs full of air. Now we're going to push that air outwards. The air is going to move past the trachea. Just a big hollow tube where that air can move. It's going to arrive at our larynx and specifically at our vocal folds. It's going to start getting these vocal folds vibrating, and it's going to produce a sound in the larynx area. So now we've got the sound being produced, and we've got our first round of affecting the resonance ongoing from the space that we've got present in the larynx. We're lifting up all of the muscles around the larynx, trying to keep the space as small as possible in the larynx cavity. The sound, now moving with its new bright resonance that it got from the larynx, is going to carry on outwards towards the back of the mouth, where it's going to get to a couple of pieces all at once. It's going to get to that politopharyngeal arch, which we were talking about is hereabouts. Again, we're going to make the space smaller. It's going to get even brighter. It's going to continue moving out to the sort of general mouth area. We're going to have the back of our tongue raised, which is going to make less space in the mouth, which is going to make the sound brighter. And then it's going to arrive at the tip of the tongue, where it's going to be formed into words by our teeth, our tongue, various other pieces of our mouth. And then it's going to exit out into the world, where everybody can hear your lovely new voice. And that's the process. Very simply done. Obviously, there are lots of other things that are going on in here that we don't have the time to cover today, or that I have the qualifications to cover, because there's, again, a lot of biology going on there that I haven't been educated on. But that's the basics of how our voice gets produced, and all the different pieces that we use to affect it as we work on vocal feminization. If you have any questions about any of this stuff, and I expect a lot of questions because this is a more complicated piece and something that we want to be, aware of as we practice, please feel free to ask. I'm always happy to answer any questions about this. There are lots of places where you can get diagrams like this one to take a look at if that's something that would be helpful for you. If you are in a spot where you're in contact with me, I would be happy to share the one that I have, this one, with you, if that would be helpful for you. But yeah, hopefully this was a help to you, and hopefully you find that this gives you a better idea of what's going on as you're doing your vocal feminization.